Thank you again for allowing me to speak to this wonderful audience that is so diverse about associated conditions with SCAD. I know, as you mentioned, as Vonda mentioned, we see a lot of SCAD patients, and a big question that comes up is, why me? Why did I get this? Why did this happen? Despite being so active, so healthy, without a significant number of medical conditions. And it can be confusing, frustrating, and isolating at some times. And so what I'm going to talk about is that although we don't have all the answers, we have some ongoing research and some hypotheses about what happens with SCAD. So there are three main goals of my talk. One is to explore the idea of the two-hit hypothesis. Two is to discuss the complexity of SCAD and the associated conditions. And third is to review three commonly associated conditions. So, with SCAD, we really think that there is a two-hit hypothesis. And what that means is that we have a vulnerable person, and superimposed on that is an external trigger. And that vulnerable person could be due to an underlying vessel problem or fragile vessels from fibromuscular dysplasia or some other type of connective tissue disease or an underlying susceptibility. And superimposed on that, we can have an external trigger. We heard from Vonda about an emotional trigger, but we can also have intense exercise trigger SCAD, as well as drugs or certain medications, as well as severe straining. And so it can be variable for different people in terms of what that underlying vulnerability is and what the emotional trigger is. It's also important to realize that the same trigger might not cause SCAD if it happens again. One point I just want to acknowledge is that for many patients, despite undergoing testing, that underlying vulnerability may not be found, or that trigger may not be clearly identified. And that is also commonly seen, and maybe in the future we might learn more. So when we think about SCAD, although we understand some of the underlying pathophysiology that we reviewed earlier, it's important to realize that there are many other conditions associated with SCAD. And the one that you've heard frequently mentioned and is most commonly associated is fibromuscular dysplasia. Other things to consider are pregnancy. We know that the number one cause of the most common cause of pregnancy-associated heart attack is SCAD. Certain autoimmune conditions or connective tissue disease have been associated with SCAD, but that overlap is much smaller than something like fibromuscular dysplasia. And then Takotsubo, which I will go into more detail, is a cardiomyopathy or a weakening of the heart associated with stress that also happens most commonly in women. So let's take a deeper dive. Fibromuscular dysplasia, or FMD, has been mentioned several times by prior speakers and also by our patient ambassador. So fibromuscular dysplasia is a non-atherogenic and non-inflammatory vessel abnormality. So that means it's not associated with plaque buildup and it's not associated with inflammation. When we think about all of our vessel walls, there are three layers that you can see on the left side of the screen. The most internal layer is called the intima. The middle layer is called the media, and the outer layer is called the adventitia. Fibromuscular dysplasia most often affects that middle layer of the blood vessel. And in the middle panel, we can see that a normal vessel looks pretty straight, whereas with fibromuscular dysplasia, you get this narrowing and dilation of the middle part of the vessel that can cause a beading appearance. And that beading appearance makes the vessel more vulnerable to dissection or other problems. It's important to evaluate with head to pelvis screening for this kind of abnormality because it can affect the blood vessels of the head, the blood vessels of the neck, the abdomen, especially the ones going to the kidney, as well as the ones in the pelvis. And so some people might be asymptomatic. They might not have any symptoms with fibromuscular dysplasia, whereas others might experience symptoms depending on where the abnormality is located. So we went into a little bit of detail about fibromuscular dysplasia, but there are other vascular conditions that I want to also share with you, but make a distinction in how they are different. So there are other inherited connective tissue disorders, which are also abnormalities of the blood vessels, but for different reasons. There's autoimmune connective tissue disorders, which are related to inflammation. So some of the key differences are that inherited connective tissue disorders are a predominantly genetic issue. So there is one identifiable genetic abnormality that runs in families and that can cause a weakening of the blood vessel. It is often affecting not only the blood vessels, but other parts of the body. And so it's important to take that history, not only of the family, but other systems that might be involved to understand whether someone might have this as an underlying condition. And then autoimmune connective tissue disease is an inflammatory issue due to the immune system attacking the blood vessels. That causes inflammation and can also affect multiple systems, but it's important to evaluate by history taking whether someone might have these. It's key to understand that with FMD, we test everyone for that, whereas these other kind of conditions, we really save testing for those who have signs and symptoms that there may be involvement. So what is Takotsubo cardiomyopathy? Takotsubo cardiomyopathy is a temporary weakening of the heart muscle, often triggered by an intense emotional or physical stress. And that's why this is also called stress-mediated cardiomyopathy. And there's a clear overlap between Takotsubo and SCAD in the sense that this predominantly affects women, and it's often triggered by this intense emotional stress. And so that's why an additional overlap has been evaluated. A key fact or a fun fact is that the term Takotsubo is actually a Japanese term for the octopus we see at the top of the pot seen at the top of the screen, which was a fishing trap for octopuses. And because of the shape of the octopus pot and the temporary weakening of the heart, it takes the shape that is similar to that. And that's why it's called that kind of syndrome. And it's often reversible. So what's the overlap? Well, a lot of the same triggers shared, like the predominantly women. And so we know that they can coexist. About 5% of patients with Takotsubo have been found to have SCAD in certain studies. And so it's important that if you're diagnosed with Takotsubo, that the physician go back and look for SCAD as well. So some key takeaways: SCAD is a complex condition that can be associated with other underlying diagnoses. There is a two-hit hypothesis of why this happens, and we discussed that in a little bit of detail. Everyone with SCAD should be tested for underlying vascular abnormalities, such as FMD. However, genetic testing and testing for inflammatory conditions should be reserved for those with signs and symptoms, since the overlap is much smaller. I want to thank Vonda for allowing me to walk with her on this journey. Despite us not having all the answers, I've learned so much from her, and I appreciate all the SCAD survivors who have helped us learn so much about this condition. Thank you so much.